Hello, everyone. I'm eager to introduce you to my wonderful friend, Melanie Wilson. When I first met Melanie, she was going through cancer treatment, and obviously I was worried about her. But I also worried about her daughters and husband because cancer affects everyone in a family. I discovered this truth when my own mother was diagnosed with cancer. So Melanie and I have experienced cancer in very personal ways. This is why I'm dedicated to working with her to reduce the impact of cancer in Tarrant County. So Mel, you've been the CEO of Cancer Care Services for a decade. Both you and the organization have gone through some pretty big changes over the past 10 years. What does resilience mean to you?
When I came to Cancer Care Services, I was a cancer survivor, as you know. And my husband was also a cancer survivor, and my daughter Lauren was a cancer survivor. So I thought I had the cancer thing and the caregiver thing all figured out. But 8 months into my brand new job, my daughter called me from the health clinic of her university. Lauren put the doctor on the phone, and he told me to start driving to San Marcos immediately. Her cancer had come back for the 3rd time, and for the next 7 months she fought, and I fought with her right by her side. But her cancer won in the end, and Lauren died the morning after her favorite holiday, which is Halloween. So after I lost my daughter, I wasn't sure if I had the capacity to be resilient. Luckily I did, though. Like me, Cancer Care Services has grown a lot over the last 10 years. During the last decade, we have doubled our social work staff. We've added dietitians, added a counselor, a play therapist, a financial advocate, and community health workers. But before even making these important changes, I began by writing an inclusiveness statement during my first months on the job. Thankfully, I know so much more today. And the more I continue to listen, the more I continue to learn.
Thank you, Melanie, for listening and making those necessary changes along the way. When I was first on our board back in the late 90s, Cancer Care Services was really focused on providing support and services for the person going through cancer. Now Cancer Care Services has evolved beyond supporting the cancer patient. Now we also care for the caregivers and we empower survivors. And this is especially meaningful to me because of my own experience with my mom. She was diagnosed with colon cancer in 2003. And it was an incredibly difficult time for me as I was worried not only about her, but I was also trying to take care of my dad. And I don't think I realized at the time how stressed out I was, and that's typical for a caregiver. So that's why providing care for the caregivers in particular is so important to me, as I know firsthand what that experience is like and how it can affect you for so many years. So Melanie, what do you see for Cancer Care Services' future?
Well, I see a future where everyone impacted by cancer, regardless of their age, their income, or their race, has equal access to life-saving cancer treatment. But right now, this isn't the case. Right now, there are groups of people who are dying from cancer at higher rates than others. Right now, there are preventable differences in the ability to survive cancer if you happen to be socially disadvantaged. So we are doing even more as an organization to ensure that everyone who is facing cancer has a fighting chance.
What is it going to take to be able to serve everyone?
Well, for a start, I'm glad I have you and Stevie Don on my side. I'm also grateful for our Legacy of Hope Giving Society members. They invest in our mission year after year, and they make it possible for Cancer Care Services to be resilient, even during a year like 2020. So as we look toward 2021 with hope, there are things we need in order to serve everyone impacted by cancer in Tarrant County. Studies have shown that community health workers play a vital role in communities where resources are scarce and where trust is broken. We have to hire more community health workers who can serve as a trusted bridge between cancer and hope. We also need to add another counselor one who speaks Spanish. And we need the technology required to provide education and support for caregivers like we were, but we need it online.
If we could accomplish these things, what would be the impact on the community?
Well, more cancer patients would have the resources they need to pay for treatment and to cope with the emotional impact of cancer. More survivors would be able to understand and manage what comes next after their treatment ends, and they would have the support they need to put their lives back together, including counseling and even help reducing their medical debt. More caregivers would have the encouragement and resources they need during one of the most challenges experience of their lives.
You know, when I was looking after my mother, every day seemed to be a blur. It was making sure we could get her to appointments. It was making sure we were talking to the doctor and understanding. We were trying to focus on the pain management. But as I said earlier, it was also making sure that my dad wasn't running himself into the ground either. He was also in the role of a caregiver, and she really needed his emotional strength and support more than any other time in her life. So if we can provide that support through the programs that Cancer Care provides that allows for someone to take even a moment just to catch their breath, the level of care to the patient can be significantly improved. And that's really what drives my passion for this organization and what it's doing.
I'm so grateful that you're on this journey with me, Robert. Thank you. And for all of you who want to be on this journey as well, those of you who care about making sure we have the resources we need to be resilient, please be part of Cancer Care Services' commitment to supporting cancer patients, caring for caregivers, and empowering survivors to reduce the impact of cancer for everyone in our beloved community.
Thank you, Melanie, and thank you for all the wonderful work this organization is doing.